Winning the Roadmaps to Health Prize for Manistee is a huge shot of self-esteem for the community and realizing that, wow, we are really doing good stuff. We're just not a little spot on the road anymore. We have something to offer, even beyond ourselves, to teach people where we've come from. The median income in Manistee is only like $25,000. So we're dealing with a population that is struggling financially and economically. The Sioux Tribe of Chippewa Indians got a grant to do community-based work, and this grant has really allowed them to be more integrated in the community.
We have our own distinct community, but we are very much a part of the larger community. Anything that benefits us benefits the larger community and vice versa.
Manistee's health is very much like the rest of the nation. They're struggling with diabetes and obesity and an aging population, but we are slowly but surely making environmental changes and systems changes to address those issues. One of our early goals was to create access to fresh, locally grown fruits and vegetables at affordable prices. When you see this frozen parking lot in January, you would never know that it's the home of the very successful and very colorful Manistee Farmers Market. We worked with the health department because they'd never had a central location of multiple vendors in this area where they could use their WIC coupons. Another goal of our project was to create an environment that was walkable and bikeable and accessible to all users. Now that we're in 2013, we need to start looking at making the shared use path a reality. We started a Safe Routes to School project, and at the same time, we started working with the city to develop a non-motorized transportation plan with an engineering firm and a focus group in Manistee. We talked about, yes, the sidewalks being really good for the health of the community. It's also good for the economic health of Manistee. While working in the broader community, we also knew we needed to work with our children to teach them and model for them how to make the healthy choices to live long, productive lives. One of the grants we got, the elementary school, brought in the exemplary physical education curriculum. One of the key points of that is to teach kids skills for a lifetime.
We've really seen a lot of empowerment from the students. They really feel excited about physical activity. We want them to be able to, take that home and then be able to, sustain that as they grow older.
Nobody can do this alone, especially in a small rural community. People who maybe have never sat at the same table together have to come together, and there has to be created a shared vision for it to work. And the collaboration and the partnership model that Manistee demonstrates on a daily basis is probably the single most important lesson that anyone can learn.